All right, good afternoon, everybody. Welcome to our February Lunch and Learn. It's 11:59 on my clock, so we're going to get started in just a moment. All right, I have us at noon exactly, so we're going to get started. Welcome to our February Lunch and Learn with the Kinship Navigator and Schuyler Center for Analysis and Advocacy. I'm going to kick us off. Just a few reminders. Everybody is on mute as this is a webinar. If you have questions, feel free to drop them in the chat. This will be recorded and distributed after our webinar today, both the recording and also the slides. So once again, Lunch and Learn series. My name is Rae Glaser. I'm the director for New York State Kinship Navigator. I'm going to kick it off just for a couple of minutes, talk a little bit about the Navigator, and then I'm going to turn it over to Crystal Charles to talk about the state of children in the New York State budget. So our Lunch and Learn series, if you're new, these are 30-minute presentations, the third Thursday of every month usually, where we come together from 12 to 12:30 to talk about a topic of interest for kinship caregivers, kinship professionals. On the Navigator's YouTube page, we have a history of all of our Lunch and Learns. They are free, register, and you can join us, or if you register and you're unable to join us, you will get access to the YouTube video on the slides. Next month, we'll have a presentation from Ryan Johnson for the Community Health Access to Addiction and Mental Health Care Project, which is CHAMPS. It's got a fantastic acronym. And so just a brief overview about the Navigator. Many of you are aware of this, but in the very beginning, we do like to do a quick review. The Navigator's information, referral, and education for kinship caregivers all across New York State. Kinship caregivers, prospective kinship caregivers, those working with caregivers. We have our helpline and our website. Our main goal is to make sure that we have connecting kinship caregivers to financial assistance, legal advocacy. We work very closely with the local kinship programs, permanency resource centers, Department of Social Services. We just want to make sure that we make that connection for families. We're a virtual program, so you've got our website, our helpline, online chat, and email. We provide information in the form of legal fact sheets, county resources in our helpline. We make referrals to local kinship programs, permanency resource centers, and other local support services, as well as the legal referral network, which includes kinship attorneys that are available to assist caregivers with family court matters, either in person or virtually. Education, our education department focuses on professionals, statewide presentations, lunch and learn such as this. We have an online video archive that you can access for more common kinship issues that caregivers may face, such as Kinship Financial Assistance 101, Kinship Legal 101, KINGAP, how to fill out an application for public assistance for a caregiver. We also provide advocacy in the form of our KinCare Coalition, which we're going to be talking more about policy and advocacy today. So that's really our focus as we are in prime season. Our KinCare Coalition, you can register right on the Kinship Navigator website for our monthly coalition meetings. They are usually the third Tuesday of every month. This month's a little bit different because we have February break, so we're doing everything the second week of the month. But our next upcoming event for the KinCare Coalition is March 5th, which will be our virtual advocacy day. So stay tuned for more information coming out on the Navigator website and our Kinship Navigator newsletter. Here's just a quick snapshot of the Navigator website. Many of you are familiar with this. Here you have your clickable map that you can click for any resource in New York State, upcoming information on what's happening with kinship care that you can register for. During business hours, we have our online chat available, and then our drop downs at the top of the page, we've got information on resources, legal fact sheet, on our online videos that I just discussed. So virtual case management, this is really the last component of what I'm going to discuss today. That is an add-on to the Navigator's information referral. In 10 counties where there are no on-site local kinship services that provide services for informal families, we have something called virtual case management, where somebody from the Navigator team will assist kinship families for up to 6 months at a time. If you're from one of the counties right here on the website on this slide, you don't have to do anything special. Just give us a call. We will make sure that you have virtual case management as an option. And what that basically will be is somebody following your case more closely than we would on the helpline. So virtual case managers can help with facilitated benefits applications. They have more in-depth knowledge of local resources, and they will do regular check-ins with the kinship family. Last shout out here is for our permission to contact form. That is a great way to get the Navigator to assist if you're working with kinship families. If you've got access to a family and can get their signature, just have them fill out the permission to contact form, fax it to us, email it to us. We will reach out to that caregiver directly rather than having to have the caregiver call us. This is really helpful for caregivers that are under a lot of stress and may or may not pick up the phone to give us a call. So that permission to contact form, you click on the link, you can download it directly. It's right on our homepage. Or if this is brand new to you and you want some more information, just reach out to me directly and I'll make sure that you have access. That's my 5-minute spiel. I'm going to turn it over now to Crystal Charles from Schuyler Center for Analysis and Advocacy to talk a little bit more about their services and what they do to track the budget in New York State. Crystal, over to you.
Thanks, Rae. I'm gonna share my slides.
All right, I can see it, Crystal. You're good to go.
Great. So good afternoon, everyone. I'm happy to be here. I'm Crystal Charles, a senior policy analyst focused on child welfare and child poverty at the Schuyler Center. So a bit about us. We're a 151-year-old nonprofit organization dedicated to policy analysis and advocacy in support of public systems that meet the needs of disenfranchised populations, including people living in poverty. Since 1872, the Schuyler Center for Analysis and Advocacy has advanced policies that improve child health and well-being, enable families to achieve economic security, and augment quality early childhood opportunities with a focus on equity. So all New York children have a fair opportunity to thrive. So 151 years ago, we were founded by Louisa Lee Schuyler, who is a great granddaughter of Alexander Hamilton. And today our work remains grounded in her ideals of compassion, advocacy, leadership, and partnership. We lead and support policy advocacy and analysis on the issues impacting New York families, including health, childcare, child poverty, and child welfare. Every year, we analyze the executive budget, legislative budget proposals, and final budget relative to the impact on children and families. We also release an annual data book, The State of New York's Children, which presents data on the issues impacting children and families. So today I'll focus on the data from that data book for this year. So we'll start off kind of at the high level. New York is home to 4.1 million children, making up 20.6% of the population. 1.1 million are under the age of 5, and we have a richly diverse population. More than half of New York's children are brown and Black. Almost a third of the children in New York speak a second language at home. 37.5% are in immigrant families. Children have also been part of the recent influx of immigrants, making up over 30,000 of the approximately 150,000 immigrants who have newly arrived in New York between October 1st, 2022 and August 2023. Nearly a third of those children, 9,800, are babies and toddlers under the age of 5. Among the top needs of newly arrived families are housing, food, honest work paying a living wage. It's just like their new neighbors. So shifting now to our child poverty analysis. Simply, too many children in New York are living in poverty. 18.1% of children, or over 734,000, live below the federal poverty level. That's higher than the average percentage of child poverty for the United States. In the Bronx, that jumps up to 35%. In Syracuse, it's 46%. In Rochester, it's 42%. Child poverty is impacting communities all over New York, urban and rural, upstate and downstate. Experiencing poverty limits a child's adult success in education, earnings, and health. Poverty also increases homelessness, food insecurity, and child welfare involvement, which we'll explore more in a little bit. For the youngest children, these adverse experiences can impair brain development, leading to lifelong deficits. The experience of child poverty is concerningly unequal. Children in Black, Latino, Asian, Indigenous, and multiracial families experience poverty at much higher rates than white children, a symptom of the multi-generational impact of racism in housing, education, employment, and other systems. This graph illustrates the percentage of children experiencing poverty in each category. For example, 27.4% of Black children in New York are living in poverty. 28.5% of Native American or Alaska Native children are living in poverty. Child welfare is one of the systems where child poverty is intertwined. Child poverty is a major driver of involvement in the child welfare system. Family struggle often results in calls to the state central register, which beget stressful and disruptive investigations, and too often unnecessary family separations. Most children placed in New York's foster care system, which is intended as a temporary measure, stay for more than a year. About a third stay for more than 3 years. Nearly 1,000 young people don't return to their family and exit the system alone between the ages of 18 and 21. This is called aging out. These young people often face severe housing insecurity and homelessness. This graph shows the disparity rates in foster care placement. Black children are 5 times more likely to be placed in foster care, and Latino children are twice as likely compared to their white peers. According to the data, Black children are experiencing extreme disparity, and Latino children are experiencing moderate disparity. These disparities have remained roughly the same for as long as they have been measured. They also remain consistent at each step of the child welfare process, from reports to investigation to preventive services. Despite the acute and increasing need for concrete supports, child welfare and other preventive services are woefully unavailable or hard to access. By the time a family has been reported to the state central register, they have fallen through the cracks in other systems, like health, mental health, public assistance, housing, and others, either because they couldn't afford services, were never referred to services, or are on public assistance waiting lists. Additionally, the symptoms of poverty and being rent burdened are often confused with neglect once a child protective services investigation begins. Food insecurity, housing insecurity, inability to pay energy bills in the winter, inability to afford laundry and other basic necessities. Child poverty has such an intricate interconnection to child welfare that is both what brings families to the attention of mandated reporters and what leads to families becoming unnecessarily entangled in the system when what they really need is support. In 2022, 12% of children removed from their families to New York's foster care system were placed in institutional settings. These are also referred to in the field as congregate care or group homes, which is significantly higher than the national rate of 9%. Separating a child from their family can bring extraordinary tumult to a child's life, the impacts of which can be worsened by placing the child in an institutional setting, which increases the chances of children suffering long-term detriments, including decreased ability or inability to attach to caregivers, slowed physical growth, delayed cognitive and language development, and behavioral issues, especially for children under the age of 13. When it is necessary to separate a child from their family, they have better outcomes when placed with relatives or adults who know them well, as I'm sure we all know. Geographically, New York City places children with relatives at a much higher rate than the rest of New York. This graph shows the federal child tax credit and how it cut New York's child poverty rate in half in just 2 years. The credits amount was nearly doubled, with the largest amount going to young children. It was restructured so that the lowest income families received the maximum credit, and part of it was paid out monthly. This is a great case study in the kind of effective public policy we advocate for here in New York. It works, transforms lives, and builds a more just society. We have it within our power to create a state where all of our children have what they need to thrive and none live in poverty. What you can't see on this graph is when the federal child tax credit expansion ended and inflation began to rise, the national child poverty rate went right back to pre-pandemic levels, and it's the same for New York State. It's a policy decision to let so many children experience poverty, which often has serious lasting consequences. It negatively impacts children's physical and mental health, academic achievement, and compromises their ability to grow and achieve adult success. Families experiencing poverty have a higher likelihood of experiencing crises related to lacking basic needs, which gets them involved in a variety of government systems, including child welfare. New York's Constitution states, "The aid, care, and support of the needy are public concerns and shall be provided by the state." During the pandemic from 2020 to 2022, the federal government stopped states from disenrolling people from public health insurance, namely Medicaid and Child Health Plus. As a result, the rate of uninsured people fell. When children and families lose Medicaid and Child Health Plus, it's generally not because they're no longer eligible. It's usually because of simple administrative hiccups, like missing a filing deadline or some paperwork. Once that coverage is lost, families lose crucial services, including preventive appointments, well-child checkups, and vaccinations. In New York, nearly 80% of our children in low-income households are covered by Medicaid or Child Health Plus. Cavities are the most common chronic disease of childhood, with children living in poverty, Black children, immigrant children, and children with special needs experiencing oral health problems at disproportionate rates because of structural inequities, including racism and poverty. Nearly half of the state's children do not regularly visit the dentist. Fewer than 66%, or 2/3, of children with private dental insurance and fewer than 45% of children on Medicaid saw a dentist in 2021. The American Academy of Pediatric Dentists recommends children visit the dentist at least every 6 months. In the field, dental providers are not as available in some geographic areas. There's a shortage of providers accepting Medicaid because of low rates that are paid to them, and generally, health coverage is inadequate. New York's children should be able to access the oral health care they need and deserve to be healthy. Now let's talk about childcare. Broad access to high quality, culturally responsive, well-resourced, affordable childcare strengthens families, children, and communities in multiple ways, including enabling parents, particularly mothers, to work and build stable finances, reducing parental stress by providing parents the space to work, appointments, and engage in other responsibilities, knowing their children are in a safe, enriching environment, leading to better health and cognitive and social emotional skills for children, and reducing racial inequities in kindergarten readiness. This also includes improving math and science performance all the way through 8th grade. Access to childcare is also good for business and the state's economy. In the last 2 budgets, New York made historic investments in childcare, which resulted in dramatic expansions in access to childcare assistance by making childcare newly affordable for tens of thousands of families. Specifically, in last year's budget, income eligibility limits rose to 85% of the state median income, which is about $83,000 for a family of 3. This allowed for 108,000 children to be newly eligible as of October 2023, on top of the 265,000 that became newly eligible in 2022. These momentous changes also reduced family copays to 1% of income over the federal poverty level. As you can see, for a family of 4 making minimum wage, their childcare payments would have gone from over $40,000 a year to just $324 a year. Jaw-dropping savings. There's still more work for us to do on this front, like including parents who work fluctuating or non-traditional hours and immigration status, but the progress so far cannot be overstated. Another major challenge in increasing access to childcare in New York is finding and retaining the workforce. Without a well-supported, steady, reliable workforce, New York cannot get to the state's goal of providing universal childcare. Childcare educators earn less than 96% of occupations in New York, less than $17 an hour on average, with family-based providers only earning an average of $10.50 an hour in 2021. Childcare providers cannot raise tuition on families to pay for increased wages because private childcare already costs $15,000 a year. For families receiving childcare assistance, the state reimburses providers, but those reimbursement rates have not risen enough for them to pay competitive wages. New York's childcare providers are stuck in what the United States Treasury Secretary calls a textbook example of a broken market. The costs of providing high-quality childcare are high, but most parents need childcare at a time in their lives when they can least afford it, at the beginning of their career, when their income is lowest, and they cannot afford to pay more. Our number one priority here is for New York to provide ongoing workforce supplements to raise wages for childcare educators. So this slide shows a high-level summary of our policy priorities. across all of our issue areas. We have a more in-depth document on our website. But overall, we are working to reduce child poverty, transform the child welfare system by making it more transparent and accountable, ensure New York invests in the childcare workforce and increasing access, and in child and family health. So I'll just say here, we're very happy to be partners and supporters of the Kinship Navigator and KinCare Coalition. A lot of our collaboration happens during the budget process to help secure funding for the Navigator and Kinship Caregiver Support programs throughout the state. We're in the midst of the budget process right now, actually. The governor has already released her budget proposal back in January, which we analyzed here at the Schuyler Center relative to our priorities. That's called the first look. That's also on our website. Next, the State Assembly and Senate will release their budget proposals, which we call one houses, in early March. So that's just about 2 weeks from now. Then negotiations between the governor and the legislature begin and go through the rest of March, with the final budget being due April 1st. There are multiple points during this process where the KinCare Coalition can make their voice heard, but for now, I'll focus on where we are. We will probably miss that window to make it into the legislature's proposals, so our attention can be focused on the negotiation phase in March. During this time, we can reach out to legislative leaders as well as the governor's office to ensure kinship funding makes it into the final budget, which will be released April 1st. So this is what the governor has proposed this year. Just to give some context, the Permanency Resource Centers, or PRCs, support both adoptive and kinship families by providing services and connecting families to resources, such as peer support, mentoring, navigation for cross-system needs, therapeutic services, counseling, or respite care. The governor proposed funding PRCs at the same amount as last year's budget. Some of this funding was also used for local kinship caregiver support programs. The governor did not propose any funding for these local kinship support programs, but the legislature usually adds in the funding amount, which is 1.9 million. The governor proposed funding the Kinship Navigator at $100,000 less than last year's budget, but the legislature usually adds in the difference here too. So as you can see, it's definitely key to reach out to both the legislature and the governor to ensure kinship programs and the Kinship Navigator are fully funded this year. So that wraps up my presentation. Thank you, everyone. Rae, I'll pass it back to you for questions and any further context you might want to add about the budget. Thank you.
Absolutely. Thank you so much, Crystal. And at the very end, wrapping in the kinship pieces to it, that is really helpful. We did have a question coming through the chat. What can we do to help? Call our legislators. Do you have any tips? And I will say for kinship, when it comes to what can we do to help? How can we get this budget passed through? Calling your local legislators, making sure that you're part of the KinCare Coalition, utilizing our talking points to educate is super important. We're right in the middle of the season where we need to be making those meetings. So if anybody has questions about them or they're unsure about how to proceed or it seems scary, feel free to reach out to us. Do you have any tips or thoughts about how we can help move this along, Crystal, that I missed?
I think you mostly covered it. Calls are definitely great right now. And I just say, remember legislators are people too. You don't feel scared. You'll get real comfortable reaching out to them once you start.
Absolutely. That's what I always say in our coalition meetings as well. They want to know what we're doing. They want to know exactly, what's going on, boots on the ground, why it's important who we're serving. We got another question. Is the OTG the only funds available? I'm not 100% sure that I understand the question, Tiffany. I might reach out to you one-on-one. The OTG, that's the other than grantee, another name for the non-parent grant. That is something that is available to kinship families in terms of financial assistance. The dollars that we're talking about in this particular Lunch and Learn pertain to funding of programs. Hopefully that's helpful. If you have a follow-up question about that, please feel to reach out offline. And I'm going to give everybody another minute or so for questions, but I think that brings us right to 12:30. Crystal, this is super helpful. I know that the policy is an enigma to most program folks, so having a walkthrough, giving us the information so that it's easily digestible is really, really helpful.
Thank
Okay,
you. You're welcome.
yeah, absolutely. We have one more question coming in. Interested in any other poverty data regarding Broome County? And it's interesting that they have this disparity.
Yeah, I will drop my email in the chat. And we can probably get back to you on the specifics for Broome County because we have a wonderful policy and data person who did all the numbers for our county, that beautiful map that we had on the slide. So I can definitely get those to you if you send me an email.
Perfect. And just a reminder that the slides will also be available, which I think has all of our contact information in on it. So Publicist is jumping in. We'll share Crystal's email when we share the slides and the video, which should go out within a week of this PowerPoint presentation. All right, Crystal, thank you so much. We really appreciate it. Thank you everybody on the call that attended today, and have a fantastic day.
Thanks.